So this video is going to be a pretty short, straightforward video that kind of addresses a question that a lot of us have before we even start to get into the nursing program, pre-nursing students. What if we get in and we find out that nursing is not for us? Let's talk about it. So for starters, you're not alone on this question. I'm pretty sure you know that. Lots of us feel that anxiety or that question before we even get into it, or when we get that admission letter and we have been approved to get into the program. What if we don't get in there? Or what if we don't like it? What if we can't do it? What if we are not good enough? All valid questions, and I just want to give you some advice, because there's a lot that we don't address on YouTube, that we search for these questions and no one really answers them. So just want to validate, normalize those feelings. They are normal, and your anxiety is valid. Now, let's say you're admitted to the program and you want to know if you should continue. Well, there's going to be some telltale signs that let you know that maybe this really isn't for you. So you're going to start having a lack of interest in the material, or engaging in classes or clinicals. You're gonna probably withdraw. You're gonna feel persistently overwhelmed by the material, or that you cannot take all of this information. You don't know what it is. It's like you're hitting a wall almost. You're gonna have like a disconnect inside, sort of like a moral or ethical obligation sometimes with some of the things that you see. That can happen as well. You might also have a gut feeling about this, like I really feel like maybe I can't do this. And for some of us, we do experience a physical or mental health decline, and we just know ourselves. We just feel like we are not meant for this. And some of the things that you can do if this happens to you is to maybe start a journal. If you are journaling now, start documenting things. Start taking note and inventory of how you feel on a daily basis, or every time after clinicals, or every week, and start to look at how things are progressing for you. Is there any progress? Are you documenting any progress? Are you feeling any different as the weeks go by? Are things amping up for you to where you feel like you absolutely can't do this? And kind of find out, is it the program, or is it the phase of the program, or is it just basically the entire profession, things that you're seeing on your clinicals, the material that you're studying? You can talk to any mentors that you may have. Another option is for you to talk to your professors. I'm sure this is something that they've seen all the time. There's people that have self-doubt. You can have a one-on-one with them and discuss it. After class, after clinicals, they may provide some motivation to you. They may also give you ways that you can sit down and assess what you're doing. Now, you may actually be doing very well in the program and still feel a disconnect inside with what's going on. Like it doesn't vibe with you. You don't like what you're going through. So they may discuss options with you, up to withdrawing from the program, taking a leave of absence if that's even a possibility in your program, I'm not sure, or changing majors, because really there are other health professions that you could be going to that might be more suitable for your personality. You could go into public health. You could choose a career that goes into public health, where you focus more on policy. You can look at becoming a respiratory therapist. You can become into social work. You can go into imaging, radiology. You can become a tech there. You can become an ultrasound tech. There are way more less stressful jobs. It's still amount of stress in those positions, I'm sure, but there are way more less stressful jobs than to become a registered nurse. If you wanted to, you could become an LVN. That still is stress. You will be reporting to a registered nurse instead of having to make the decisions all yourself. If that is something that you struggle with, being the one that is responsible or the leader basically and making decisions, then consider going to LVN or LPN, the LVN or the LPN route. Consider changing the environment in which you want to be in. You could also become a medical assistant. You can work at an outpatient facility. Consider if it's the fact that you are doing clinicals and rotations in a hospital that is making you feel this way inside. You could also just kind of assess yourself and see if there's what were you interested in before? What are your other options? What's your interest? Is there something else that you would like to kind of pursue and see if you'd be better at that? Take a self-assessment career type of exam. You can find those online on some websites. So these are some options that you can do. Now, another question that pre-nursing students or students that are already involved in the program may have is, if you are receiving financial aid, what do you do about that if you leave the program? So when it comes to student loans, see if there's some kind of forbearance program, see if there is a deferment type of thing that can happen with your loan, or any other repayment options that they can modify if you choose to cut yourself short in that program. There's also scholarship and grants, which you should not be responsible to pay back, but you would always want to know what are the implications of withdrawing, even if you have a scholarship or a grant. You also want to consider future education costs. So if you stop this and you go down another road, what is the cost of that other thing that you want to get into? Decide to go on that road. Should you go to community college first? Even if you're a pre-nursing major right now, should you go to community college first to kind of lessen those costs is a great thing to consider. If you're on the fence about whether or not nursing is right for you, should you go to community college first? To lessen the cost, should you decide that if you end up deciding that nursing is not for you, perhaps consider part-time work as well while you're in the program, so you can kind of lessen some of that financial burden. You also want to understand the credits. If you're in the program and you decide to quit, how much of those credits would be transferable to something else? How much of your general education and some of the science courses that you took, if you were to go into something else in healthcare or some other field, how much of that work can you transfer to that different major? This would help you so that you don't feel like you've just totally wasted your time. And a lot of this, you'll probably have to have some kind of emotional recovery, because yes, it's kind of difficult to come to that conclusion that this actually wasn't right for me. You've probably told your family members and friends that you're going to become a nurse, only to feel and find out that this just isn't for you. And I want to let you know that it is totally okay to mourn the loss of that idea, or to give up on it, or to feel like, no, I need to change course. This is okay. I hate to sound cliche, but it's true. The one thing that you learn in this profession is that you only have one life to live. You don't really have time to waste. So other people's perceptions of you got to learn to decide that that's of less importance to you than you living your life. You might have some self-blame involved. You might feel like a total failure, but understand that it's a good thing that you are self-aware, that you are actually sticking up for yourself and deciding that this is not for you. But you have to focus on your future, because you're the only one that's going to live it. So find out what it is that excites you. What are your goals? Go and try to pursue those things that really interest you. Seek support in friends and family that actually get it and understand. If you have nobody around you, maybe try to find some groups somewhere, or even on Facebook or wherever it is that you you are on social media, Instagram, there's always a group of people that can identify with that and empathize, because I think this is an emotion that we all have when we find out that something isn't good for us or we perceive to be failing at something. So if you realize that nursing isn't for you and you have already graduated, then you probably realize that there is burnout in this. There is compassion fatigue when it comes to this, because there is an emotional and physical toll that comes with this nursing career. There may be moral injury. You may find out that systemically in acute care or in hospitals that there are staffing shortages. There are things that you see that just doesn't sit well with you. And also you may be disillusioned all this time, and then you become a nurse, and then there's this gap between what you thought nursing was like and then the reality of the job. That happens often. And then feeling unfulfilled. Even if you're good at it, it might not bring you the joy or the satisfaction that you thought it would bring. There's also specialty mismatch. It could be that you're just in the wrong specialty. You probably just hate your current specialty, and you could go to another specialty. You might do well in outpatient or a clinic setting or something else. So that issue is fixable. It's definitely fixable. That's basically what my thing was. I'm a UM nurse and I'm totally satisfied now. So me going to nursing school wasn't completely a fail. If you want to look at it that way. I found where I could be more useful. Instead of taking care of one person, I'm taking care of a whole population of people. So, and just not face to face, but I'm making sure that they get the care that they need and get approved for those services. So I'm helping in a different way. So yeah, but find out if it's just a specialty issue. But if this should happen to you, the number one thing I would really hope that you don't do, but you know, hey, it happens. Just don't panic or quit immediately if possible. Try to give yourself a future date in which you'll give yourself time to kind of process and work through these issues and see if this is really something you should just throw in the trash, or, you know, pursue something else, go in another lane, try a different specialty, like I said, and then go see if there's some non-bedside nursing roles that would be more suitable for you, as I mentioned. So there's nursing informatics, which you will need another degree for. There's case management, there's utilization review, which I am in. There's also education that you can go and get your master's in. There's occupational health nurse. There's so many things. There's legal nursing, there's forensics, there's medical writing, there's telehealth or remote. There's telehealth nursing. Understand that your skills are transferable if you are already in the profession. So you've learned a lot about critical thinking, communication, teamwork, and leadership. These are all transferable skills that will look solid on a resume should you decide to leave or go to another specialty. Time management, organization, prioritization. You've also patient education, empathy, and compassion. These are all skills, both hard and soft, that make you suitable for any other thing, including management and other types of fields. If you are already a nurse, leverage your income, pay off those loans, do part-time work, consider dropping to part-time nursing. You know, you already have a specific income and you're afraid to lose that. I would make a plan to save aggressively before you leave that job or that career. Consider part-time nursing. There are per diem jobs as well. You can also utilize your degree in other positions, as I mentioned, manager types of roles. You can work for the government. So your degree didn't come, you know, at a loss. But overall, just try to destigmatize changing paths. You're allowed to change. That's all we do during our lifespan is change anyway. So you are allowed to change your mind. Celebrate your achievements, because if you came this far and you became a nurse, you seriously went through some hell to get it. Work on rebuilding your identity and really understand that you are more than just a job title or a career. You're not just a registered nurse. So explore other hobbies and interests as you will, as you must, and seek therapy if you must as well, or coaching from other people. Continue to network, see what other possibilities are out there for those things that you may be interested in. So overall, just understand that you are more than your job, and it is okay to change your mind. Hopefully these tips were helpful to you if you're feeling this way. Do me a favor and subscribe, click like, do all the things, subscribe, and hopefully I will see you in the next video. If you're looking for some non-bedside positions, consider looking at this video here. Bye.